Folks, please join me in welcoming, in a virtual way, Howard Catton from the ICN.
Thank you all. Thank you, Wendy. I'm absolutely delighted to be able to join you for the launch of the 3Cs Café. I think it's a wonderful initiative. I think it's an exemplar, and I think it's something that not only did I want to be able to find a few minutes to support you with the launch today, but to promote it to others around the world as well. I'm waiting for my latte and Lamington though, so you know, how are you going to get that to me? I'm sure you'll find a way. Let me just say a few words about why I think that this is such an incredibly timely and important initiative. You know that ICN has been monitoring and tracking the impact of the pandemic on the global nursing workforce, and the toll that has been taken on nurses' physical and mental health has been immense. We've reported on many aspects of that, including more recently what we're seeing in terms of some of the data about the global nursing workforce, with nurses leaving early, retiring, levels of burnout and stress as well. You know that we went into the global pandemic with a shortage of 6 million. When we look at the numbers of nurses who were due to retire, and in addition, what we've described as this COVID effect, we could be looking at having to replace 12 to 13 million nurses around the world over the next few years, which is huge and enormous. And that means we need to do everything we possibly can to retain the folk that we have. And I think one aspect of what you are doing, providing people with a space to talk about their experiences, will directly help to retain nurses, and it's why I'm very pleased to promote it in other countries as well. One of the things that I was often struck by when I listened and talked to nurses during the peak of the pandemic, when you ask them where they got their support from, one often assumed that, you know, their family were a really important source of support for them. But time and time again, nurses said to ICN, they're worried enough about us. We're not talking to our family. They're concerned about us going to work and the risks to us as well. And nurses were just holding, you know, the psychological pressures and burdens. So providing a space where people can come and speak safely, I've heard you say a number of times, I think in an environment where there's no judgment and there's no blame, where people will very quickly realize that they're not on their own, but others are sharing similar experiences, I think will be hugely important for those individual nurses' health and well-being, but also to help to retain nurses. But the other thing that I think that will be hugely beneficial from what you're doing, we found this again during the engagement events that we had with nurses over the course of the pandemic, was the enormous opportunities for sharing and learning. People talking about their stories, their experiences, the problems, but how they overcame them, barriers and issues, and learning from each other. And I wouldn't underestimate some of perhaps the energy, the innovation, the ideas that may come, and make sure, I know you will, capture and share those as well. And the other thing that we noticed, and I'll be interested as what your experience is as well, is, as well as, and Wendy, you said, you know, we're a huge profession, and absolutely, we, you know, 28 million strong, we are, and we can often feel, you know, bizarrely, ironically, quite lonely. So giving a sense of that community, the professional group and support around you. But not only that, a lot of these discussions, I think, take us to places where we realize that there are key other groups, civil society groups, community groups, public groups as well. One of my observations that I've seen in a number of places around the world where nurses are trying to advance the nursing agenda is that the public and patients have been, I've said it a number of times now, I feel have often been ahead of politicians in terms of wanting to prioritise and support nurses as well. So I think that this is, I know that this is a cafe for you as nurses, but I have no doubt it will take you into places where you're thinking of connections with other groups as well. The theme for International Nurses Day this year, let me in advance and early wish you happy International Nurses Day for next week. Any midwives, happy International Midwives Day for this week. Our theme for International Nurses Day is Nurses a Voice to Lead. Invest in nursing and respect rights to secure global health. The Invest in Nursing, you know, has been a strong line and work that we've undertaken with WHO for the last 2 or 3 years. But we've really stressed the respect rights this year, because I'm afraid to say that in too many places, we see that rights are not being upheld, are not being respected. Nurses who are working in unsafe environments, where even, you know, fundamentals around data on incidents isn't being reported, assessments and support packages not being put in place. And despite all of the fine words we often hear, you know, there's still only around about 40 countries which have signed up to the Global International Labour Organization Convention on Nursing Personnel, the only global convention that we have on nursing personnel. So the respect for rights, the safety and the well-being of nurses is central to the report that we'll publish next week. Make sure that you all get that, and I send that to you, Wendy, as well, because there is, as well as all the issues around nursing education, nursing leadership and nursing jobs, there is a section about well-being of nurses in there, and it includes some of the practical actions we think people can take to support nurses' well-being. And again, your initiative is a wonderful exemplar and fit with all of that as well. I did a message last night for my for our colleagues in New Zealand for their celebrations for next year, and I with the risk of getting into trouble with them with what their plans are for next week. They are taking a Maori saying to put at the heart of their International Nurses Day celebrations, called Marangai Mai, which means rise up and come together. It's theirs. It's not ICN's, but I loved it. I thought it was just a really pertinent for right now in terms of what we need to do. And when I was recording and thinking about that yesterday, knowing I was going to speak to you today, I thought I must share that with you as well, because you can see the fit with what's with what you're doing. I do also, final point, and I just do also think that you will, you know, don't underestimate the therapeutic benefit of what you'll be doing through this cafe. You know, it's an expression of humanity, and there will be people who will feel lonely, will feel perhaps close to, you know, lonely, depressed, isolated, and what you can do on a human level to help and support people, I think, will be invaluable. But as I say, as well as that gentler aspect to the solidarity that you're offering, I also think that there's a strong aspect to your solidarity, because there will be energy, and there will be enthusiasm, and there will be laughter, I know, that will be created as well. So for all of those reasons, I wish you well, and I look forward to staying in touch. And as I say, Wendy, very, very happy to promote this as a concept, as an idea to nurses other parts of the world. Something that you should perhaps write something for us about it at some point, and we can put that on the website and distribute it. Back to you.